All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So, the discussion today is very interesting. We're going to talk about the current state of the Omicron related mortality compared to how it was before, and the current state of the long COVID incidence or prevalence compared to the ancestors of Omicron. This discussion has been some of the cool beans who may still be sheltering in place because of their own reasons, including some comorbidities as well. It is important for them to understand what is the current risk. And I had been trying to collect this data for some time. So today I am here with some of this information for all of us to kind of level set that where do we stand. So let's start. And of course, in summary, we are in a much better position than where we were before. So this is drbeen.com. In the description of this video, there is a link to have access to drbeen.com. And for the cool beans who already are a member of drbeen.com, I wanted to show you as part of the new the plans page that we have made. In addition to that, this is the new library page. So this has all the videos listed in one place. You can go to the left side and then you can click on that, and that would bring you to that particular video. For example, all emergency medicine videos are here, or GAT, all GAT videos are here, and so on. So this, I think, would make it easier to go through the videos. And can you imagine that all of this list of videos is accessible for under 100 price? So anyways, this is drbeen.com. Here are various studies that I'm going to go over. So I'm just going to leave it here and let's go to my drawings. So these are gifts for humanity. They're continuing. Let's start. So the first thing, what we are going to talk about today is long COVID after Omicron versus its ancestors, and long COVID after reinfection. So this is also very interesting that, hey, if somebody had the Omicron infection and then had Omicron again, what happens? Will they develop long COVID? What kind of incidence is possible? So just for our to level set, these viruses with these little beards, these are the ancestors, and this Drbeen virus is the Omicron for the next part of the discussions. The first study, and I'll show you the study afterwards, but the study is summary. This study is done in hematology patients. The study's summary is that mortality is reduced in Omicron era, and long COVID prevalence is also reduced in Omicron patients. Now, how reduced? So they have in this study three variants that they looked at: the ancestor or Wuhan variant, then the Delta variant, and then Omicron. And for mortality, I think you'll be surprised. Look at this. With the ancestor variant, the mortality was 42% in this cohort of the patients, hematology patients. In Delta time, the mortality dropped to 9%. And there are going to be multiple reasons for that, not just the virus being different, but maybe the community being different, the resistance to the virus being different, the immunity that is developing, and so on. So there can be more factors than just the virus. And then finally, in Omicron time, in the same cohort of the patients, mortality has reduced to 2%. So that is a huge change from where we started and to where we are. 42% mortality to 2% mortality. Then long COVID risk, 46% in this cohort of the patients, hematology patients. 46% of the people who got COVID, symptomatic COVID, diagnosed COVID, were becoming long COVID in original variant. Then in the Delta time, it became 35%. And in Omicron time, it dropped down to 14%. Once again, they're talking about hematology patients. They're not talking about healthy individuals. Still, it's a huge change. So then here is a study. Mortality and burden of post COVID 19 syndrome have reduced with time across SARS-CoV-2 variants in hematology patients. And we just discussed it. I just want to quickly show you the, after you have already seen these numbers, one more sentence that is really important, and this is for those folks who are not patients but have been sheltering in place or have been still avoiding or themselves in the virus. These researchers are saying, given this trend, the trend of reduced mortality and reduced long COVID prevalence, we believe clinicians should initiate conversations about risk with their patients on whether to maintain any self-imposed social isolation. So what is the point of this? The point is that even hematology patients where mortality was very high, where the long COVID incidence was high, even there the suggestion is that, hey, it looks like the virus is almost kind of become less dangerous. So maybe have a discussion about the stopping the sheltering in place. So very, very encouraging. Okay, so then next study, cancer patients. And this study is cancer patients that are vaccinated versus cancer patients that are not vaccinated and the prevalence of long COVID. This does not look at the mortality, just the prevalence of long COVID. So let's start with this. Once again, ancestor. This is the pre-vaccine time. So most of that was Wuhan time. So pre-vaccine time was Feb 2020 to November 2020. Remember in November 2020, then the vaccine started coming in and people started getting vaccinated. So then the alpha and delta time from December 2020 to December 2021, almost a year. Then Omicron time, December 2021 till January 2022, and you could say that continuing. Overall incidence of long COVID in this cohort, again, these are patients, these are cancer patients, 16% overall, all. Then in the pre-vaccine time, when people were not vaccinated, number one, but they were also infected by the most brutal variant, and that was 19.1%. Again, the variant could be more brutal because we were also not, we haven't also developed any immunity. So there must be multiple factors, the vitamin Ds, we didn't know what to do, and so on. So prevalence was 19.1%. And of course, they were all unvaccinated. Then came the alpha delta time. Here, the vaccination had started. In here, those who were not vaccinated, their prevalence for long COVID was 18.3%. Again, we're talking about cancer patients. And then those who were vaccinated was 16.8%. Not much difference, 18.3 versus 16.8. And then in the Omicron time, once again, look at the overall reduction. And here, vaccinated, 6.2% are becoming long COVID, again, cancer patients. Not vaccinated, 9.4%. So here, an important thing is that if somebody is not vaccinated, we can, of course, not attribute the improvement towards the vaccine. So this would also mean then the development of the immunity in this society, plus the development of or the virus becoming less severe. And there is a postulation. So the question that we all, as cool bean scientists, should think about is, why is less long COVID because of Omicron versus the original or previous ones? So one of the thought by a scientist was that as the variant that is capable of affecting more of the body, more of the organ systems, produces more long COVID. And that variant that affects lesser of the body systems produces less long COVID. So Omicron compared to Deltas and Alphas and Wuhan spreads less to the remaining body, causes less of the damage, stays more towards the upper respiratory tract and even towards eyes and ears, but not really a lot towards the pulmonary system and the remaining systems. Again, that still happens for some. But in general, because of that, it may be causing less long COVID, which again is a good news. Eventually, if Omicron converts into a human coronavirus, becomes resident only in the throat, does not cause any further damage, and just lives like the other human coronaviruses, then we're done with it. So, anyways, this study in cancer patients went down from 19.1% unvaccinated to 9.4% unvaccinated, and in vaccinated from alpha delta went down from 16.8% prevalence of long COVID to 6.2%. And these are cancer patients, they have comorbidities. Very good improvement. So this is the study, SARS-CoV-2 Omicron related COVID-19 sequelae in vaccinated and unvaccinated patients with cancer, results from on COVID registry. And these are the findings that I just showed you. Of course, they have some more data. The links are in the description. Then next study. This is in the healthcare workers from Switzerland. And this also is in vaccinated versus unvaccinated. So in this study, there are 4 cohorts. Number 1, uninfected. Number 2, pre-vaccine. Number 3, alpha delta. And number 4, Omicron. They did not put these timeframes on it. I just left them. These are actually from the previous study of UK timeframe. So it is possible that Switzerland may have a different wave time duration. So these dates may not account for the correct duration for Switzerland. Now, what did they see? So in this one, they talked about after 18 months or after 6 months or after 3 months, the number of symptoms still present in people who were infected. And what they saw was that uninfected people had 0.39 symptoms, meaning uninfected people. If you walk up to someone who has never been infected and you say, hey, do you have any respiratory infection or do you have cough or sneezing? And someone will say, yes, I am sneezing. So 0.39 symptoms. Then pre-vaccine time or Wuhan ancestor, 1.12 symptoms compared to 0.39 symptoms in uninfected. So almost 3 times. Then alpha delta, 0.67 symptoms after 3 or 6 months. And Omicron time, 0.52, almost similar to 0.39. But here is a very interesting thing. Those that were unvaccinated, you're gonna laugh. Those that laugh in a good way. Those that were unvaccinated, they had 0.36 symptom, which is almost the same as uninfected, 0.39, even better than that. Those that had 1 or 2 vaccines, they had 0.71 symptoms. And those that had 3 or more doses of the vaccine, 0.49. So in this study, interestingly, this is healthcare workers. In this study, interestingly, those that were not vaccinated, they even had better symptom set compared to uninfected ones. So I would say that's same. So that means in this study, vaccine did not show any efficacy for long COVID protection. And before you start throwing paperweights at me, those who are pro-vaccine, they actually say that in their study here. They say vaccination before Omicron BA.1 infection was not associated with a clear protective effect against past symptoms in this population. So this is just how it is. So this is that study. What is the outcome of this study? This study is saying that Omicron in unvaccinated healthcare workers, meaning healthy individuals, they had lesser long COVID developed, or almost no long COVID developed. The vaccinated did develop some long COVID, and there could be this reason that those that are vaccinated may have age factor with them, may have comorbidities with them. So there is a difference between not vaccinated versus vaccinated. But whatever that is, this particular cohort from Switzerland had unvaccinated developing no long COVID and vaccinated developing a little more, but much better than previous cohorts or previous variants. So across the board, compared to the previous variants, things have become much better with the Omicron. And once again, there is a postulation that that may just not be the Omicron itself, it could be other factors too. I just have to keep repeating that because somebody is going to just watch this part and say, why didn't you talk about the other factors? Okay, so then this is British data. So let's very quickly look at this data. Here, actually here. So this is the Office of National Statistics, new onset, self-reported long COVID after coronavirus reinfection in the UK. So this is a very interesting data set. This is reinfection. So first time infection to reinfection, and what is the risk and prevalence of long COVID in this situation? Very interesting data set. If somebody is interested in understanding what is the current landscape of Omicron, mortality, long COVID, they should watch this video. So here, or if they don't want to watch the video, then they can take these links and just read these links. So here, ONS in UK says, and look at the date here, this is Feb 2023, so pretty recent data. 4% of adults, and their definition of adult, 16 and over, and 1% of children, young people aged 2 to 15 years, report having long COVID 12 to 20 weeks after the first coronavirus infection from November 2021. So 4% and 1%. This number in itself is quite low compared to 30% or 40%, or for example, in healthy individuals, here the Veterans Affairs Hospital said, what was it, 13 or 14%? The UK's previous studies had showed even up to 34% of long COVID. Here we are talking about 4%. So there's a huge difference. Then among those who did not report having long COVID after a first COVID infection, this is very interesting. This is infection after the infection and then the prevalence of long COVID or incidence of long COVID. 2.4% of adults and 0.6% of children. What does this mean? If somebody is going to get the long COVID with the first time infection, then the incidence is 4%. But if somebody is going to get it after the second one, they did not get it with the first one, then their chances of getting it is less. So the prevalence is 2.4% in adults and 0.6% in children. So very interesting, almost trending towards 60% of the first time infection. So this was really interesting for me, that infection after the infection had a lower chance of long COVID if the first event did not cause long COVID. Then they say, after adjusting for factors, the odds of new onset self-reported long COVID among adults were 28% lower after a second COVID infection. So this is after adjusting the data compared to the first infection. Then similar differences in adjusted odds between first and second infection were observed when focusing on new onset long COVID that limited daily activities, but at lower levels of prevalence. 2.8% for the first infection. So this is the long COVID which has made a person disabled enough that they are bedridden or they are not able to conduct their day-to-day function. So in this case, first infection can cause 2.8% long COVID. The second infection, 1.6 for second infection, and that is for adults, and children 0.6% and 0.4%. There was no evidence of difference in the relative risk of reporting new onset long COVID after a second COVID-19 infection compared with the first infection by age, sex, ethnicity, and others. So this was the Office of National Statistics. Very interesting data. 4%. I never thought that we'll reach a point that we'll read 4% of long COVID or even 2% of long COVID. And then finally, this one, risk of long COVID associated with Delta versus Omicron variant of SARS-CoV-2. So now this is Delta versus Omicron. In this one, what they said is, we identified 56,003 UK adults first testing positive between December 20, 2021 to March 9, 2022, who satisfied the inclusion criteria. The cases are hereafter referred to as Omicron cases, which was 70%. And then they have another time frame, which was the Delta cases. Female, in all of these studies, female are slightly more, like 51% or 52%. Here in this study, 55% for Omicron and 59% for Delta. And what did they see? This is really, really interesting. So look at this graph with me. So if you see here from top to bottom, all age groups, vaccine more than 6 months, vaccine 3 to 6 months, vaccine lesser than 6 months. And if you look at the prevalence here, let's look at the top number here. Overall prevalence 0.26 by Omicron. What does this mean? This means that 0.26 or 26% is the same as Delta. The remaining 74% is reduced in Omicron. So Omicron's long COVID in people who were vaccinated more than 6 months was 74% reduced compared to Delta for people who were vaccinated. So this is vaccinated to vaccinated Delta versus Omicron. Then here, vaccine 3 to 6 months, Delta versus Omicron, vaccinated to vaccinated comparison, 0.24%, 0.24, which means 24% similar, and then 76% reduction in Omicron time. And similarly, this is interesting for me, vaccine lesser than 3 months, 0.5. So Delta incidence was 50% the same with the Omicron. Omicron was 50% lesser. Then here is the 18 to 59, and this is the greater than 60 years. So if you see here, the differences are 18 to 59, 0.23, 60, 0.28. Still a huge reduction in the incidence of long COVID across all ages. So that was very interesting for me, because this must be a question as well that, hey, how about my age? If I'm slightly older, then what? So look at this, more than 60, vaccine 6 months before, and 72% reduction in long COVID. So these are the discussions. Once again, in the description of this video, there are some links. You can get access to Drbeen, or you can use other links to read or to support this work. Thank you very much. Let's very quickly look at the comments to see if there is anything interesting, and then we'll break. And please remember, for tomorrow, I will not be doing the lecture because I'll do 2 Zoom sessions with the supporting beans, or YouTube supporters or Substack supporters, or the Patreon supporters. We sit down together on a Zoom call and we discuss various things. Tomorrow, we're going to discuss the effect on the endocrine system of SARS-CoV-2. That will be the discussion. Thank you very much. Links are in the description, and please like, subscribe, and share. I'll see you day after tomorrow. Bye for now.